What is up, YouTube? It is that time. We need to talk about CRNAs and nurse practitioners. I've been thinking about taking this video. I don't even know what I'm thinking here. Taking a video. Sound like my dad in 1995. Let me take a video of you, Dave, blowing out your candles. It's high time we shoot a video talking about nurse practitioners and CRNAs. Let's jump right into it. I have been fascinated with the CRNA profession for the past few months. It's been really interesting. I've done a lot of research on it, and it's a good career, and I really want to talk about nurse practitioners and CRNAs. My setting is a little bit different. In October, I moved into my new house. That's right, I bought a house. Literally the biggest purchase of my life. It is quite terrifying to buy a house and to go through that process, but at some point I'll do a tour for you. I'll show you around. This is what my setting is probably gonna look like for the next little while until I start traveling again. So welcome, thanks for watching. If you're new here, take a look at some of my other videos. I talk about nurse practitioners. Today we're talking about CRNAs. Comment below if you wanna be a CRNA, or if you are a CRNA, you better comment below. I want to get in touch with you. I want to talk to you. So thanks for watching. Nurse practitioners and CRNAs. I'm going to start with nurse practitioners. I've got my computer set up right here, so I'm going to be glancing over it on occasion to look at my notes. I'll talk about nurse practitioners first because that is something that is very easy for me. That's not who I am. I don't really describe myself by my career and my profession, but that's what I do. And so as a nurse practitioner, you have to have your bachelor's degree in nursing before you go get your master's degree. Caveat, there are a few direct entry programs of where you earn your BSN in the process of earning your MSN, but overall, you need your BSN before you go to nurse practitioner school. Nurse practitioner school, there are two ways to do that. So there's a master's degree and then there's a doctoral degree. So an MSN or a DNP. And I graduated in 2014, and way back then, that's a few years ago, everything was mostly MSN for direct entry. There were some DNP programs, but largely across the board, most of them were MSN programs. And so my program was MSN, and those are usually 2 years, and it largely depends on where you're going. So if you're going somewhere full-time, part-time, et cetera, it can be longer, but historically 2 to 3 years. The doctoral degree is going to be more around 3 to 4 years, 3 to 5 years. Again, depending on how many classes you're taking, et cetera, all those factors that play in. So that's kind of what the NP education model looks like. You also have to choose a specialty, which is something in my other videos that I've really tried to pick a bone with, because I think it's just crazy, and this is not the video for that, so I'm gonna leave it right there. But you have to choose a specialty. You have to choose family nurse practitioner, pediatric nurse practitioner, primary care, acute care, adult gerontology, acute care, psychiatric mental health, women's health. I believe those are the current specialties under the consensus model. Prior to the consensus model, which kind of dictated NP specialties, there were other specialties like geriatric nurse practitioner. I think there was a school nurse practitioner. None of those exist now. I think they're grandfathered in if you're actually one of those people, but overall there are just a select few specialties that you choose from. And so whenever you choose that specialty, it is not like bedside registered nursing. So as a registered nurse, you can go work in the ICU, then you can go be a school nurse, and then you can go to the ER, and then you can go to med surg, and then you can go to women's health. You can go to a clinic. You can just once you get your RN degree, you can practice across the board in whatever setting that you want. However, as a nurse practitioner, you have to specialize, meaning you choose a specialty certification, and that's kind of what you're stuck with. So family, you are stuck with doing primary care, urgent care, etc. Pediatric acute care, you're stuck with just dealing with pediatrics in the acute care setting. So maybe the emergency department, the inpatient setting, a specialty practice, the ICU. If you do adult gerontology acute care, you're stuck with the adults in the same scenario. So adult acute care, inpatient medicine, critical care, some specialty service, things like that. Women's health, obviously you're limited to just women's health. And so your scope of practice is largely dictated by your specialty. So family nurse practitioner, it's outside your scope of practice to practice in the ICU because that's not primary care. acute care nurse practitioner, it is outside your scope of practice to practice in primary care. That's not your scope of practice. And so your scope of practice is pretty narrow depending on the license or the certification that you choose. If you go with family, that's kind of the most broad one that you can do. You can do across the lifespan primary and urgent care. You can dabble in the ER if you pick up some of that training somewhere. So you have to choose a specialty certification. And I think that's just a downside, honestly, because the PA profession, you don't have to do that. You're a generalist, go practice wherever you want. I'm trying to get on this soapbox and I really need to stop. So I'm going to stop now. It's not the video for it. We're talking about NPs and CRNAs. So that's a little bit about the NP profession. Through school, minimum, you have to do 500 clinical hours to sit for most of the board certification exams. I know for family and for acute care, adult, 500 hours minimum. Most schools require 700 to 800 hours, 600 to 800, I would say. Some require the minimum 500. However, most go a little bit over. I think mine required 800 maybe. I really can't remember, to be honest with you. 700 or 800. A few hundred over the bare minimum. And so that differs with most medical specialties. PAs over 1,000 hours. We'll talk about CRNAs shortly, but I'm trying to tell you about nurse practitioner education. And so once you're trained in that, you function as a nurse practitioner. You can function largely in an advanced practice role / medical role, even though you're not practicing medicine, you're truly practicing advanced practice nursing. But some of those overlap. And so as a nurse practitioner, you're treating disease, you're prescribing medication, you are diagnosing people with whatever. Again, depends on your specialty. If you're like women's health, maybe you're just diagnosing them with like a UTI or a yeast infection or BV or an STD, all those fun things that happen down there. As a family nurse practitioner, maybe you're diagnosing hypertension, high cholesterol, diabetes, etc. And then you are treating those illnesses or those chronic diseases. So with prescriptions, you're going to write a prescription and have them follow back up. Or if you're in the acute care setting, maybe you are starting antibiotics on a septic patient, or you're starting vasopressors on a hypotensive patient, or you are rounding on your surgical patients if you're in a surgical service. So think of NPs as more practicing under the physician medical model. Even though we're not trained under that model, that's really how we practice. We practice largely as, I'm not going to say we practice as physicians because we're not physicians. I'm not a physician. But we practice under that medical model of diagnosing, treating, prescribing, evaluating, following up. So that's kind of how the nurse practitioner profession works. And your scope of practice, again, is determined by your specialty certification. So if you work in a family medicine clinic, you may see a 2-year-old with a URI, and then you may see an 80-year-old with bronchitis or pneumonia or something. So it just largely varies depending on your certification. Now, let's kind of contrast or compare that with CRNAs. So CRNAs, prior to ever going to CRNA school, according to the nurse anesthesia website, their specialty, their board certification, you have to have at least 1 to 2 years of critical care experience. And that critical care experience is defined very broadly as taking care of hemodynamically unstable patients. It doesn't really define the environment that you're taking care of them in. So ICU, ER, what have you. But it's really defined based on the patient population that you're taking care of. And so are you doing hemodynamic monitoring? Are you managing ventilators? And again, most of this ends up being in the ICU because that's where the critical care patients go. And then the big question is, can you go to CRNA school with ER experience? I actually did some research on this. So there are just a handful of programs that you can go to with ER experience. Very few. The broad majority want experience in critical care, in a dedicated ICU. So if you're not a dedicated ICU nurse, probably not a good idea to try to go to CRNA school. You really need some sort of critical care experience. Now, that being said, if you're in a small subset of the population that works in the emergency department that takes care of vented patients on the daily, hourly for 12 hours at a time, if you manage vasopressors, if you manage art lines, if you rarely manage a swan in the emergency department. I've worked in the ER for 7 years. I've literally never seen a swan line in the ER. Like, that doesn't happen. We don't float the swan in the ER. That's something that you do in cardiac ICU. So if you, maybe you manage an art line, maybe you manage vasopressors, whatever your critical care experience is, it really needs to be like dedicated critical care. You're taking care of like ICU level patients on the daily for 12 hours. That's what they're looking for. And you're going to get that in ICU. You're probably not going to get that in the ER. You're going to get that some days, but not every day. And so I was talking to a CRNA recently, and this is why you need critical care experience. I didn't think about this. I thought maybe, as a CRNA, you're going to be taking care of like the appies and the choles and the walkie-talkies that like come in from the ER, and you're going to be, putting them under general anesthesia while they do their surgery and wake them up and send them out. But I didn't think about this. Like, you're also going to be getting the surgical ICU patients that come down to the OR for whatever surgery they're going to have. This was like mind-blowing to me. I'm like, I totally did not think of that. They're going to be coming down from the ICU. So as a CRNA, you're going to have to manage that ICU patient while you're putting them under general anesthesia. So that's not something that I like really put some thought into, but it does make sense that you really need to know how to take care of an ICU level patient and put them under general anesthesia. So that's why you need ICU experience. You also usually have to have some sort of advanced chemistry class. So most of these programs require you to have like general chemistry 1, general chemistry 2, organic chemistry 1, organic chemistry 2, biochemistry, maybe physics. And it largely depends by program. You will find some programs that you don't have to have all these advanced chemistry courses, but the large majority are going to require you to have some sort of advanced chemistry course, usually within the last 5 years. And so, in nursing, pre-nursing, you don't really take the advanced chemistry courses. You don't take organic chemistry 1 and 2. Maybe you do. Where I went to school, I wasn't required to take all these advanced chemistry courses. That's more of like pre-med, you're going to med school. And they want it within the last 5 years. And so most people have to go back to like community college or online university or something, somewhere, COVID times online, to take advanced chemistry, to take like organic 1 and 2 and then biochemistry and really make good grades, because that's the next point that I'm like segueing into. You have to have good grades to go to CRNA school. Like I don't know the average GPA. I would say probably 3.5, 3.6 to go to CRNA school. I'm sure people have gotten in with lower, but you probably have to explain yourself. But overall, you need good grades to go to CRNA school in your hardcore science classes. So if your science GPA, and a lot of the programs look at that, they look at science GPA, meaning if your science GPA is like low, you need to fluff it up, take some extra science-based courses, biology, chemistry, physics, whatever. Not any nursing-related courses, but you need those science courses to like boost your science GPA. And so there are prereqs you have to take. And again, that's going to vary by program. There are some programs that don't require that. They recommend it, but they don't require it. And then some programs really require you to have these advanced chemistry courses or physics courses. And also, before you go, most programs require you to have CCRN. So your CCRN certification is like strongly recommended, because that shows that you are an expert. It's a board certification for bedside nurses, and it shows that you are an expert in the critical care environment. And so I would say half, 3/4 of the programs out there like strongly recommend that you have CCRN. There are some programs that like it's a hard requirement, like you can't apply to this program without your CCRN certification. And so again, that's going to depend on the program that you choose. So another thing, GRE. You're probably going to have to take the GRE. Some programs require it, some don't. It depends on, again, where you're going. As far as tuition, man, holy moly, CRNA school is expensive. So compared to nurse practitioner school, I didn't talk about this earlier, but nurse practitioner school, maybe like 15 to 50,000 in that range. Some probably more expensive. And again, that's going to depend on where you go. If you go to a public institution, it's going to be cheaper. If you go to a private school, it's going to be more expensive. Same with CRNA. However, the cheapest like CRNA program that I could find is like $30,000 to $40,000 to $50,000. And that's the cheapest. I mean, that's nuts. $30,000 to $50,000. That's crazy. Yeah. So the average program is like probably more like 70 to 120,000. Like that's really expensive. So if you're planning to go to CRNA school, like you're gonna have to probably take out student loans or like save a chunk of change to do this. Once you apply to these programs, I would say like 100% of CRNA schools require an interview. And that's something a little different from nurse practitioner school. So nurse practitioner school, you can just apply and literally everybody can get into NP school. It did not used to be that way, but now like you could probably like apply to CRNA school on your cell phone and like get in the same day. And that just like blows my mind because, again, not the video for that. CRNA school, you're gonna have to apply and get an interview. And some of these places, it depends on where you go. You might have to take an entrance, like a critical care entrance exam. You might have to have multiple interviews. Some of these interviews are like panel interviews, and their questions vary. There's no set, it's like standard as to what they ask you. Some of the programs do clinical questions, so they ask you like describe taking care of such and such XYZ patient, or talk about the pathophysiology of acute coronary syndrome or sepsis or whatever it is. And so you really have to like be good at interviews, because go to CRNA school, you're gonna have to interview. Nurse practitioner school, some require interviews, the majority do not. So that's a difference. Once you practice, or let's take a step back. Once you get into CRNA school and you start, most of the programs are now DNP. So a couple years ago, there was probably half DNP, half MSN, but now like 90 to 99% of the programs are like DNP direct entry. And so there's not a whole lot of master's programs out there. And the few master's programs that are out there are switching to DNP. I don't know the exact dates on this, but by like 2022, 2024, somewhere in that range, every program for CRNA school has to be DNP direct entry. Now, again, I don't think they're requiring you to get your DNP if you're already a CRNA, like if you're already like grandfathered in under that, but new CRNAs, like if I were to go to CRNA school now, I would have to go into a DNP program because that's what they are. They're all direct entry. Nurse practitioners tried to do that a few years ago. They tried to set a deadline to say by 2020, we're gonna go to all DNP direct entry programs. Blew that out of the water. There are tons of MSN programs out there for NPs now. There are DNP programs, but there are mostly MSN programs for the NPs. So once you're in CRNA school, it is like highly advised that you don't work, because it is a pretty strenuous curriculum, I guess we could say, strenuous program. And I feel like that's probably that way across the board, because I was talking to a CRNA recently and they really described like FNP and CRNA. So FNP, your scope of practice is like, this long, but it's like that deep, little minor type stuff. As a CRNA, your scope of practice is like 2 inches wide, but it's like, 1,000 feet deep, because there's not anything that an anesthesiologist can't do or can do that a CRNA can't do. So they kind of function the same. Whereas like a emergency physician and an ER nurse practitioner, there are some things that they can do that I cannot do, like a postmortem C-section. Like they're trained on that, and that's not something I can do. I would never try to do a C-section. Literally, no. Most things ER nurse practitioners can do that ER physicians can do, but there are some that are just, we don't do. And so as an anesthesiologist, CRNA, they function exactly the same. There's nothing that an anesthesiologist can't do that a CRNA can't do, if that makes sense. I'm getting so mixed up. Nothing that an anesthesiologist can do that a CRNA can't do. I think that's right. Okay, yeah, I think that's right. All right, so going into school, it's a very rigorous program. You're going to spend a lot of time studying, probably. They highly advise you not to work. So don't work through the CRNA program. And then once you finish, you have to take your board certification through school. Let me get my thing pulled up here. So for, again, NPs, 500 hours is minimum. For CRNAs, you have to have about 2,000 clinical hours 2,000 clinical hours and about 600 clinical cases. And so whenever you're in CRNA school, much like NP school, whenever I was in NP school, we had to like log our patients that we saw. And so by the end of the program, we had this big like log of basically everything that we've seen. And so CRNA is much the same. You have to log your clinical cases. You have to have 600 or over clinical cases that you've done as an SRNA, so student, registered nurse anesthetist, and then about 2,000 clinical hours of like practice. And then you sit for your national certification. It seems that the NP national certification is probably easier than the CRNA because NPs, most everybody can pass that. CRNAs, there's some struggles out there apparently. I've looked at like the program pass rate. Some programs are like 70%. I'm like, that's crazy, but there are quite a few programs that have lower pass rates and people take the exam multiple times. So I'm not a CRNA. Again, if you are a CRNA and you're still watching, you comment below. I need to get in touch with you. I want to talk more about this. So once you get into practice, you're doing anesthesia. And so you can, from what I understand, you can specialize. You can do just OB, so like epidurals. You can do like general cases. I think if you work in like an academic setting, you're going to be more, you're going to have the ability to like specialize more and to do just more of one thing. Whereas if you work in a community hospital out in rural America, and there's like a general surgeon, you're gonna be doing whatever that general surgeon does. So appies, choles, maybe bowel perfs, traumas, OB, you just do a little bit of everything. And so it's much like being an ER nurse practitioner. If we work in an inner city setting, we're gonna be seeing probably a small subset of the population, whereas if you work in rural America, you're gonna see literally whoever and whatever walks through the door. Like at my job now, it's mainly a dedicated adult ER. We do see kids, but there's literally a pediatric hospital across the street. So we don't see kids. And so as a CRNA, your scope of practice is pretty broad in that sense that you can practice anesthesia across the lifespan. You don't have to go back for an additional CRNA certification to practice anesthesia under the pediatric population, if that makes sense. And so once you start practicing, you're doing anesthesia only. That's like your goal in life, anesthesia, and you get good at just doing anesthesia. And so it's much different than the NP profession. So again, the NPs, you're like practicing across the lifespan, doing a whole host of different things. Maybe suturing procedure-wise, you're doing, depends on your certification. So acute care, maybe doing central lines, LPs, art lines, whatever. As a CRNA, you're practicing anesthesia. However, kind of segueing into that, procedure-wise, anesthesia will put in art lines, they'll put in central lines, they'll start vasopressors, whatever they need in the OR. They'll do hemodynamic monitoring. And so you do learn those advanced procedures in CRNA school. So that's a little bit about NPs and CRNAs. I'm sure I didn't cover everything relevant to these two things, but I've been wanting to do this video for a while, and I thought now is the time. So again, if you want to be a CRNA, comment below, let me know. If you are a CRNA, seriously, comment below. I want to get in touch with you. Thanks for watching, and I'll see you next time.